As you know, vaccine helps us develop immunity to any illness, any infection, without actually getting the illness. So in a way, when we vaccinate, we trick our immune system into thinking that we are experiencing illness. This is a kind of a shortcut into being protected against illness without actually having that illness. And by giving vaccine, we train our immune system and getting ready for fight. You know, we don't send our soldiers to war without training them how to fight. It's the same thing here. You can use the same analogy. We train our immune system to prepare for a fight when virus tries to infect you. So that's the kind of idea of immunology, vaccinology in general, and it is the same idea with COVID-19 vaccines. Regarding safety of vaccines, when it comes to specifically COVID vaccines, the clinical trials done by manufacturers included tens of thousands of people. So there were large studies done in multiple countries, different age groups, different races, different circumstances. So there were pretty intensive and large size studies. But even after the vaccine is already being administered to people, then there is a surveillance system set up. There is several different surveillance systems set up to watch for vaccine safety, analyze as data comes in. And because of such a safety systems, we know some possible side effects that can happen. Because we have such a system, we were able to detect some of the side effects that were not known before. For example, a blood clotting disorder with Johnson vaccine, or as announced, Guillain-Barré syndrome with a Johnson vaccine, for example, or some myocarditis cases of the Pfizer vaccine. We know about them because we have the safety system in place. And I have to say, though, all vaccines, even though they right now have emergency use authorization and they are not so-called approved vaccines, they still go the same through the same testing process. Recently, I'm hearing this word that I wasn't hearing before, that this is an experimental vaccine. And this is a very misleading, because when you say experimental vaccine, that means that you didn't go through entire process of experiment, complete it, and come to conclusions and prove it. And it is not true at all, because emergency use authorization means to get it, you have to go through the same 3 phases of clinical trials to get emergency use authorization. It is the same 3 phases for emergency use authorization, same 3 phases for approved or a licensed vaccine. So somebody, when they're talking about, oh, I'm not going to get experimental vaccine, they were misled by people who have, I don't know, some kind of agenda to confuse people. This is not an experimental vaccine.